Now, October is Domestic Violence Awareness Month, and Congresswoman Donna wants to make sure victims in Maryland know about the resources that are available to them. She joins us now live from Capitol Hill. Congresswoman, thanks for being with us today.
Thank you, Laura.
Please explain to us why there is such a growing need for help right now when it comes to domestic violence.
Well, I think what we know is that we've spent a lot of time over these last many years since the Passage Against Women Act in 1994, bringing a lot of federal attention and resources to domestic violence, that we've done an amazing job of getting people to identify themselves as victims so that they can become survivors, engaging law enforcement, engaging prosecution, engaging our faith-based community in helping survivors of domestic violence. And as a result, of course, there's a tremendous demand for resource needs, and that's why I was focused on the work that's going on at Prince George's Hospital Center.
Yeah, tell me about the Domestic Violence and Sexual Assault Center there at the hospital in Cheverly. What kind of resources are available?
Well, the Sexual Assault Center has been around for about 40 years, and at Prince George's Hospital Center, it represents an opportunity to reach out to the community in a different kind of way. Forensic nurses who are available to collect evidence to document abuse, victim advocates and counselors who are there, some who accompany victims and survivors to court proceedings and offer counseling services as well. And of course, the kind of advocacy that women need, and connecting them with other resources in the communities, perhaps shelter and other kinds of counseling services. So it really fills a tremendous need, and unfortunately, the demand for those services has been really high in our community.
Yeah, and I know this is an issue you have been a very strong advocate for many years. You mentioned part of your work. I know you're a founding member of the National Network to End Domestic Violence. So right now your efforts are focused on trying to get more funding for this center. Are you experiencing a lot of pushback in that effort?
Well, what I will say is, in a strained economic environment, of course, resources are strained for volunteer and other kinds of resources, but also for funding. And of course, in the Congress, a lot of shelters and services around the country are supported through the Family Violence Prevention Services Act, which provides funding to states that can go to local communities. And we want to make sure that, especially in these tough times, we're making the kinds of and the services that people need. And, you know, I always say all the time, if you look deeply into what's happening in our prison and jail population and almost ask all of those people who go through those services their experience, it turns out that so many of them experience violence in their home that they witnessed or that they perpetrated.
Yeah, it would be
and so it's a deep crime.
Shame. It would be a shame to see these types of resources go away. Congresswoman, let me also ask you how victims can find out more about the services that are available. Well,
one of the things, there's a national hotline that operates. It's 1-800-799-SAFE, S-A-F-E, 1-800-799-SAFE. And of course, in the pages of any telephone directory, you can find services at Prince George's Hospital Center, at the Family Crisis Center, offering services. And of course, many of our faith-based community provide services as well.
All right. 1-800-799-SAFE. Congresswoman Donna Edwards, thanks for being with us.
Thank you.